Hi, my name is ZARIFAH ZAWANAH, and today I will talk about a career as a cardiologist. First of all, we must know that a cardiologist is a physician who is an expert in the care of the heart and blood vessels. They assist patients by treating any cardiovascular problems. Thus, their studies are mainly focusing on the human cardiovascular systems that involve the heart, blood vessels, and blood. Before we dive deeper into the cardiovascular system, I would love to introduce to you one of the famous cardiologists, which is Dr. Varuvan Jivanandan. He started practicing medicine in 1985. He studied at Columbia University College of Physicians and Surgeons, trained in surgery at New York Presbyterian Hospital, and completed his fellowship at Columbia College of Physicians and Surgeons and the University of Pennsylvania. Some of his achievements include performing bloodless cardiac surgery, performing 1,000 heart transplants, and successfully performing an adult heart transplant using an undersized pediatric donor. Now we jump into the anatomy of the heart, which in this video, I will explain about the three main parts of the heart, which are major blood vessels, four chambers, and valves. For blood vessels, we may classify their function into two categories. One is vessels that return the blood to the heart, while the other one is vessels that carry the blood away from the heart. If you can see here, the vessels that return the blood to the heart include the vena cava and pulmonary veins that carry the oxygenated and oxygenated blood respectively. The pulmonary trunk and aorta, on the other hand, carry the oxygenated and oxygenated blood respectively out of the heart. Moving on, these are the four chambers of the heart, in which we have two atria and two ventricles that belong to the right and left sides of the heart. The atrium of the heart generally works as the receiving chamber, where the right atrium receives blood from the vena cava, while the left atrium receives blood from the pulmonary veins. Upon entering both atria, the blood goes to the ventricle to be discharged to the lungs and body through the pulmonary trunk and aorta respectively. Without valves, heart may not function at its best, as valves allow blood to flow in the right direction and prevent backflow. The atrial valves or atrioventricular valve consist of mitral valve and tricuspid valve that control blood flow from the atria to ventricles. As for ventricle valves or semilunar valve, it consists of the aortic and pulmonic valve that control blood flow from the ventricles to the lungs and the body. Next, we will cover the cardiac cycle, which explains how the heart is functioning to pump the blood to the body and the lungs. There will be 5 phases, which are atrial contraction, isovolumetric contraction, ventricular ejection, isovolumetric relaxation, and ventricular filling. First of all, atrial contraction occurs when the atrium is in systole, which results in the opening of the AV valves. This allows the blood to enter the ventricles. Next, during ventricular systole, the isovolumetric phase causes pressure in the ventricles to rise, which leads to the closure of the AV valves and SL valves. Then, there will be ventricular ejection. This is due to the contractions of ventricles due to higher pressure. This will also cause the SL valve to open, allowing blood to pass through it. After that, an isovolumetric relaxation occurs, in which the ventricles become relaxed and blood in the aorta and pulmonary trunk falls backward. In this phase, SL valves and AV valves are both closed. Last but not least is ventricular filling, which occurs during ventricular diastole. This phase is where the ventricles continue to relax, the AV valve opens, allowing the blood to enter the ventricle, which has been in the atria of the heart since during the ventricle systole. We acknowledge that the heart is very crucial to allow gas exchange between the human body and the environment. Nevertheless, this could not happen without the erythrocyte, which acts as the transportation of oxygen and carbon dioxide. This is due to the presence of the 4 polypeptide chains, in which each of them contains of 1 ferrous, which is the site of oxygen binding. Therefore, One hemoglobin is compatible with 4 oxygens to bind. Moreover, with the help of carbonic anhydrous, carbon dioxide is able to diffuse in blood plasma and become bicarbonate ion, which later will be regenerated again as carbon dioxide as it gets eliminated through exhalation. Now, when we talk about the cardiovascular systems, there will be a lot of chronic disease related to it, and the most common one is myocardial infarction, or well known as heart attack. Patients with this disease may show symptoms like chest pain, shortness of breath, and passing out. This disease may occur due to the blockage of the blood vessels due to plaque that mainly forms by cholesterol and fat. There are several risk factors for developing this disease, including age and sex, family history of heart disease, lifestyle, and certain health conditions like obesity and diabetes. Therefore, some treatments that may be given by the doctors are like anti-clotting medication, nitroglycerin, morphine, and thrombolytics. I think that is all from me. Thank you.